The number one athlete who tears their ulnar collateral ligament is a baseball pitcher. And it's not just any baseball pitcher, it's a baseball pitcher who throws with high velocity and throws with high velocity and high volume, meaning lots of pitches during a game or lots of pitches during a season. But there's other athletes also. Javelin throwers, much less common a sport for players to engage in. There's also football players who can injure their ulnar collateral ligament. And sometimes it happens not from throwing, it could happen traumatically. It could happen in wrestlers who land on their elbow and put stress on their ligament. And the other frequent athlete that I see, believe it or not, are gymnasts. And gymnasts are one of the rare athletes that I see it in both elbows, the left and the right, because they tumble. And when they tumble, they put stress on their elbows. And some of the youngest athletes I've ever had the opportunity to take care of with ulnar collateral ligaments are these small pre-adolescent gymnasts. Healing a UCL tear is very challenging. It's a small ligament that does not have great blood supply. Some injuries heal very well. The ulnar collateral ligament is the exact opposite. It does not like to heal. That's our challenge. Small tears can heal with a period of rest and rehab, and the rehab is not focused primarily on just making the UCL heal, but identifying factors that may have led to the UCL tear and eliminating those factors for the future. Such factors might be you have an injury to your forearm muscles, and if your forearm muscles are compromised through fatigue or injury, that will increase the stress to your UCL. So part of rehab is to always emphasize forearm muscle strengthening, whole kinetic chain from your leg all the way up to your shoulder, strengthening and flexibility. And with time, we can get the UCL, the smaller tears, to heal, eliminate some of those factors that contributed to the UCL injury, and we can get some players to get back without having to have surgery. In addition, what's new and exciting about medicine is we have biologic treatments. Biologic treatments means we can do things to enhance healing of tissue, and the UCL needs more biologic tissue in my practice than any other injury. PRP, which stands for platelet-rich plasma, is one of those biologic treatments. That treatment is where we take a blood sample from the arm, just like you would go in for any blood test if you were seeing a doctor. That blood gets put into a machine. The machine separates the components of blood and isolates healing factors in the blood from the other factors, such as red blood cells or white blood cells. The isolated healing factors we call PRP, and using ultrasound guidance, we'll inject that PRP right into the area of the UCL injury. And for some athletes, that is proven very successful for healing a UCL injury without having to have surgery.